It's your boy number 5. Namaste, Merry Christmas, Happy New Year. You can see I've got the professional get up going on today. I ain't messing around. Now, as part of this festive season of Diaries of Doctor Number 5 that I promised you, I want to start off with an episode called Vulnerability. This is about patients and doctors trying to come together to see things from the same angle. As much as we try and make things a team decision, often the doctor has an agenda, patient has an agenda, and finding that balance is key. If you think about a doctor being in the hospital as very much home ground, it's a very unfamiliar environment for the patient, not comfortable at all. The GP practice is somewhat a middle ground, neutral venue, so to speak. And this story is about a gentleman who came in to see me at a practice in the Midlands, and he was an elderly gentleman, very nice, well spoken, but clearly had something on his mind. It was a usual busy day at the practice for me, so I was trying to crack on, don't want to be there until silly o'clock at night. And gave him my usual friendly introduction, and he told me about his problem, which was mainly relating to his waterworks, and I said to him, okay, is that everything that you've been having trouble with? He goes, Doctor, I've got something that I really do want to talk about. I'm not sure how to talk about it. He kind of waffled on for a little while, and I was like, do you know what, this is something that we can address later. So I said to him in my usual kind of hybrid Indian doctor way, don't worry about it, sir, we can do an examination first and then we'll deal with whatever else is on your mind. The examination in this situation is one that involves putting a finger into the back passage. A very simple procedure, gun position, plenty of lubrication, up, in, out, and you have a feel around, hope for the best. Obviously you pull out the finger afterwards and have a look. Anyway, this is not an educational episode, okay? So if you want that kind of stuff, Google it. Let me set the scene. So the patient was bent over on their side in the fetal position, knees up. That gives me excellent access to where I need to go. And I usually kind of let them know what I'm going to do to them, usually helps the situation. Get your mask on, apron on in case of any spillages, and most importantly, glove. So I prepped the patient nicely, warned him what I was about to do, and in I went. As soon as I was in, I heard a loud scream. Doctor! Well, what is it? Doctor! He looked at me in the eyes, he says, I've got a very, very small penis. Okay, I think we're done here. Now, I don't know what you took from that story, but I reflected on the case, and to me, you have a man who was clearly feeling vulnerable. He was in an alien environment with his pants down, a man's hand halfway up his rectum, and he had some insecurities about himself, which he felt at that point in time was the best time to blur it out. Now, looking back at it, it seems a bit silly, but actually we do a lot of crazy stuff when we're put under a stressful situation. And as a doctor, it's important to remember that patients might be feeling that way all the time, or for a majority of the time. And sometimes all it takes is to let them express those insecurities early, and it helps the whole process. So for me, it was a good learning point. Maybe before I kind of hurried him onto the couch, it would have been better to explore his thoughts about his small tickle tackle, and he might have felt more comfortable for the rest of the clinical procedure. Who knows? So that's my first one in a little series that I'm going to set up for you over the next few weeks. Hope you enjoyed it. Peace.